one of the things you want to be doing is to reduce the amount of simple carbohydrates, so very sugary things. So obviously there's your obvious things such as your sweets, cakes, biscuits, those sort of things you want to be reducing. But you also want to look at the other carbohydrates that you're eating. Eating white carbohydrates, so white bread, white rice, white pasta, all of those are very simple carbohydrates, means they get broken down very quickly. You want to be looking to try and switch those to the more whole grain varieties, which are more slowly digested and therefore release their sugar more slowly. And you want to be adding more fibrous carbohydrates to your diet. So that's your fruits and vegetables. So you want to be thinking about, making maybe a switch from a white potato to a sweet potato, which has got more fiber in it. Fiber is also really good for our gut and our gut health as well. So sort of making sure you're getting a bit more fiber, switching your carbohydrates to more complex, slowly digested than your simple can make a real difference. You often hear we talk about low GI or high GI foods, and people that have diabetes often go through an education process that teaches them about those. And again, that's all to do with the release of the sugar into your bloodstream. So you want things that release sugar slowly so your body gets a chance to handle them, as opposed to getting a big spike in blood sugar. And if obviously as part of treating your diabetes, an aim is usually to try and lose some weight to help reduce the risk of the disease continuing, you want to be looking at other aspects of your diet. So you want to be reducing the amount of fats you're eating and switching those for more healthier fats. So less of your saturated animal fats and trying to balance that with some more of the healthier fats that contain a good balance of healthy fats, polyphenols, and the omega fats that we know that are really good for our overall health. And you want to be looking at your protein to make sure you're eating sort of leaner proteins and fish. Or if you're a vegetarian, you want to be getting your protein from your beans and pulses and alternatives. So a big part of a diabetes diet is managing your carbohydrates, but overall making sure that you're eating a balanced diet across the food groups. And also importantly, don't skip meals. We know that it's much better for our body to be having 3 meals a day, can all make a real difference to helping you manage your blood sugar, but also start to lose some weight as well.